Well, it's just a little past the top of the hour. Again, thanks to all of you for joining the webinar today. We appreciate all the efforts that have gone into preparing the content that we have available. I'm Ferris Taylor, Director of the Healthcare Executive Group. And today's webinar is one in a series of webinars that we have been holding. Today we'll be discussing how clinical history is critical to effective care management. And that'll be building on webinars that we've had on health policy, care management technologies, and the last one on the impact of second opinions. Before starting, let me mention a couple of housekeeping things. All attendees will be on mute, but throughout the presentation, we want to encourage you and have you feel free to click the Q&A button in the box to the side of the panel and submit questions. We are planning on saving time at the end for questions, and if there are questions that come up during the presentation that are directly relevant to that flow of the content, I'll present those. And finally, because I know many of you will be interested, the webinar is being recorded, and we'll be sending you a copy of that recording and the slides and some reference resource materials in the next few days. As I said, we're excited to have you join us for this insightful and informative discussion today. Effective care management requires a 360-degree view of patient information. It's especially important to timely, cost-effective, holistic individual care, and in closing those gaps in care that we all experience. Real-time, actionable member and patient information and intelligence delivered in a convenient, easy-to-use way is the only way to really fully optimize care management. And you will see during the discussion today that we will touch on more than half of the HCG top 10 issues. And those issues have been prioritized by our members back at the beginning of the year. We'll touch on cost, transparency, consumer experience, data and analytics, holistic individual health, interoperability. All of those things will be part of this discussion. And you can find more about the HCG Top 10 at our website at hcg.org. We appreciate having Justin and Kat on the call with us. Kat Thorpe is Director of Product Innovation, and Justin McMartin is Product Manager from Surescripts, and they have been a longtime technology partner with HCG. So with that brief overview of what we're going to talk about and that introduction, Justin, why don't you introduce yourself, and then we'll have Kat introduce herself, and we'll kick off the discussion.
Yeah, thank you, and welcome everyone. We appreciate everyone's time today. My name is Justin McMartin. I'm a product manager at Surescripts, and I focus on our clinical interoperability areas. So that's really dealing with any place where we're exchanging data outside of the specific prescription management that you're probably all familiar with what Surescripts does. You know, my background and why I'm very excited about today is, you know, we've been making some great progress related to care management, and through my experience working in the electronic health record vendor world, and then now in interoperability here at Surescripts, it's such a necessary component of interoperability that we need to enable. So very excited to present this today. So I'll turn it over to Kat though to introduce yourself and get started.
Thanks, Justin, and thanks, Ferris. My name is Kat Corbin. I have been working in healthcare for over 25 years in about every single role. On the healthcare technology side, I have started as a software developer working on heart monitors. I set up MinuteClinic's very first quality assurance team, and then have been a program manager for a while, until I found my most favorite job leading the clinical interoperability portfolio here at Surescripts. And it really is my most favorite job because I get to use my life and my career to make an impact for good, especially in that care management space. You know, I haven't had the best health throughout my life, but I have had the best healthcare, and I have been really lucky to have the best care teams. And so as we talk about how the care management space today and the role that Surescripts can play, and how all of our customers are really working to build that Surescripts Network Alliance. I come at it from it being really important in my career, but also as a patient, and how we can really transform these patient experiences together. So we're going to give you a quick overview today on Surescripts. Let's see if I can get this to move. Some of the challenges that we're having in care management, the research findings that we went through when we took a really user experience approach, and how data empowered care management really brings us into that improved journey for a patient. So at Surescripts, we really do have that goal of that 360-degree view of the patient as they move across the entire healthcare ecosystem. And Surescripts has a unique vantage point. We see each market, each segment of the marketplace dealing with each one of these challenges differently. But the awesome thing is that we also see that we all share that one common goal and that focus on the patient. We keep that patient in mind, we can address these challenges together. And when we do it together, we're in a far better place than addressing them separately. And that's how we've built our business, along with our customers who are participants in the Surescripts Network Alliance. We bring together virtually all EHRs, pharmacy benefit managers, PBMs, our pharmacies, and clinicians. Whether it's in the specialty space, in the pharmacy space, in the acute world, or in the post-acute care world. And we bring everyone together to help solve these challenges together. And we feel that we were built to transform all of those interactions between the clinicians, the pharmacists, and the patients. And it's a big year for us because it's our 20-year anniversary. And we've spent 20 years connecting each one of those healthcare ecosystems together by connecting 2 million healthcare professionals with actionable intelligence for 324 million patients. Last year, we processed 17.5 billion healthcare data transactions. And that included more than 1.91 billion electronic prescriptions. We're impacting patients by improving the prescription process, helping deliver out-of-pocket prescription savings, and connecting clinicians with important patient medication and clinical information. Justin's going to talk to us about specifically the challenges in the care management space.
Yeah, so thanks, Kat. As we take a look at this screen, what I'm really wanting to do here is to just give you the picture of the areas that we're going to focus on for today. So, take your own organization and think about what areas either have care management and you might have some challenges, or think about the areas that of your organization where care management functions might help to benefit you, but you just don't have the tools you need to be able to support that. So as we look at each of these boxes, I'll just briefly touch on many of the challenges that we heard throughout all this, and then we're going to dig into these as we go throughout. So when we look at care management, I mean, the core of what it is being able to take all of this disparate information together about a patient and make it effectively work for them and the patient. And so that leads to many different silos of data that exist in today's world. And so that's ultimately, if you are creating an interoperable solution, you're having to connect to all of these various different systems. So all of those different data feeds. The next piece of it is, how do I know when to get those members into those care management programs? How can I be proactive versus reactive as I'm looking at my members or my patients that I'm working with in those areas? And then how am I reaching out to them in those? Obviously today with the various tools that we have that are able to connect, I probably have 15 different chat functions on my cell phone these days, let alone the ability to actually call me. How do we actually engage them in the right ways, and how do we get that right level of information to be able to do that? And then underlying all of what I just mentioned, the barriers that ultimately exist between that, whether it's legal barriers in terms of how we share data and what agreements need to be in place, versus the types of needs for that information and whether that information is in any kind of a consumable format, which really ties to that last piece of, how do we ultimately automate these activities so that we're not having to interact with some of these background things that if we had that data in place, we'd ultimately be able to produce an effective list of members that we know are engaged and willing to be worked with to help support those areas of care management. So that's just a really kind of high level of the challenges that we see out there in the industry. And at the end of the day, because of all of those things, the patient information not being available ultimately makes all of our care management programs fall short of their true potential. Because if we take a step back away from those individual data points that I got you thinking about, and we look at the system as a whole, what we run into is understanding that those areas where care management is the most benefit are both the areas, or probably first and foremost, the areas where it's the most dangerous to the patient, because it's in those areas of transition between an emergency room visit to home care, or an emergency room into the inpatient setting and then to a long-term care facility. Those types of interactions are where it's the most dangerous for the patient. And then as we translate that into the world of our health plans and payer partners that we're working with, it's also the most costly. And if we can effectively do that better, we're going to get patients better care and ultimately reduce the overall cost of care. I don't think that is surprising to anyone, but just wanted to put that out there from the outset. Then I want to just share one brief example of this from a personal perspective. My wife a couple of years ago had some health challenges that resulted in being admitted into the hospital a couple of different times and several emergency room visits. And after we got everything, she's fine. After we got everything straightened out, about 2 months after that, we got a call from our health plan care management group. And it was very disheartening to me as somebody in the interoperability world to get that call and say, hey, we see Carrie's having some challenges. Is there anything that we can do to help support that? And the response was, man, this call, if you would have called 2 months ago, would have been amazing. I did need some help, and it would have helped us out a ton. So just keep some of those things in mind as we go throughout the rest of this presentation. So I'll hand it back to Kat now so that she can take us through kind of our journey that we went through and kind of digging into these areas of care management. Oh, sorry, I forgot. We have a poll question related to the topics that I just talked about. Why don't we open that up so folks can take a stab at answering that and giving us some challenges. So how often are you or your care managers able to access the timely clinical information that they need to help the members and the patients that they're working with? So hardly ever, sometimes, often, nearly every time, or always?
And Justin, those are really tough options to answer. I'll be very interested in the results. As with you, I've experienced not personally, but family and others that have been frustrated. Every time they go to the doctor, they have to start over with their medical profile and then see things on the profile that are out of date, prescriptions primarily. Oh, I haven't taken that for 2 years. Those things don't improve or increase the confidence and the trust level that we as health plans and providers want to be generating with our members, with our in our relationships. And I think more importantly, the magnitude of the data that is needed to answer this question when you say how often do you have timely access to the clinical information. There's so much of it from so many directions that need to come in. So I'm seeing some results come in. Sometimes, overwhelmingly, the largest response. Not seeing anything in nearly every time or always. Luckily, hardly ever is a low percentage. Often is right there as well. Justin and Kat, any comments on this?
Yeah, I mean, that's not surprising to me, because what we see as we are working with our partners is that there's often some level of connectivity, especially when you start looking at from kind of a regional perspective. Those heavy folks that you're working with, we've sent up point-to-point connectivity. We've been able to engage and get some of the necessary information in. It's when folks fall outside of that region, or they fall outside of those really kind of heavy utilizer partners that we work with, where those information gaps start to exist. And so sometimes or often it makes perfect sense to me.
Kat, how about you?
Yeah, I would agree. And because we hear the terms care management or interoperability or the right information at, timely right information. And because we hear it so often, some of those become umbrella terms or just generic used words that we don't really dig in. And so that's really when we heard that sometimes in the care management space in our research, that's really why we wanted to double down on our findings from that user experience lens. And that's how I'm going to walk you through this next phase. So Justin and I've been very lucky to get to work with him for the last 6 years. And we have been talking about interoperability and making sure that the right information at the right time and the right place gets there. But I don't think that that always comes to life until you experience it along with the user. And I remember one time we were in a post-acute care setting that it still had a care management function, and we watched somebody log into 5 different disparate systems, print something out, scan it into a system, then print it out again, scan it into a different system, make lots of different phone calls. So yeah, they had the right information, but it was a huge headache to get it into the one place where they could start to make clinical and care management decisions. And you know what? The only line of sight that they had purview to was the information that they had, and they didn't necessarily see where they were flying blind. So they were still very much in that reactive, sometimes I've got most of the clinical information, I think, but I'm not sure. And so when we brought our portfolio into that care management space, we really wanted to make sure that we understood that user-centered mindset, that user experience, how they were interacting, what were those important touch points, those moments that matter, so that as we built out our processes and systems to support care management, we were doing it right. And so that's where we went through this really user-centered mindset. And when we did in that care management space, we found that 3 current areas that were ready for innovation. We interviewed a lot of care managers, and it was wonderful to spend time with each one of them. They're so heart-centered. They are purpose-driven in their job. They are there to help make people feel better. And they go to great lengths to find all of the information. It's just not always there, and it takes a long time. And we know that, our care management functions are financially driven, and we don't always have that level of time to put for one care manager, for one patient, to get the right information in a timely manner. We also found from a holistic point of view that we really only had sometimes clinical data or sometimes medical data, but we never had clinical data, medical data, and that social determinants of health. So really bringing that 360-degree view of the patient and all of the driving behaviors behind their healthcare outcomes. And then we knew that sometimes, right? Sometimes, because a lot of our data is in silos. Some of it flows through across the entire healthcare ecosystem, but not all of the data flows through seamlessly all of the time. And so that's the 3 areas that we really wanted to dig in from a challenges standpoint. If we, start with our care managers, they were very passionate about our jobs. They are there to spend time with those patients and walk with them back into a state of wellness, or they're there with them also on that journey. And so we know that the most rewarding place for the care managers is really improving outcomes. And how we wanted to position the solution was making sure that they had the ability to have that 360-degree of the patient, so they could move from reactive to more proactive. When we wanted to, move ahead of the care management place into kind of the data part of it, we wanted to take a look at, we know that that reactive data that we have is coming from our claims data. But in order for us to move into proactive, we really need to have access to that timely clinical data, medical data, and seeing what we can do to blend it together with some of those social determinants of health. Because when you get that full picture of where a patient is and it's timely, that's where we can really move into our goal of taking the care management function into the predictive. So if we liquidate the data to where it's timely, we've got that really holistic view of patients and able to flow it through, that's where we're able to make really big changes, not only for the care managers so that they get to the data and the clinical data, the medical data, and the social determinants of health, so they get to make the outcomes for those patients better. But we make sure that we're improving the programs, and then also making sure that we're putting it into a predictive model. So wherever that data comes in from into the care management space, that we are able to position it to be an impact for good. And while this is a very simplistic view of the data and the data silos, it starts to point to where there's a lot of data, but it's not flowing across each one of the different people who are playing a part of the patient's health here. And the pain points here start to kind of outline those moments that matter for the patient, the moments that matter for the care managers, and really improving the outcomes for the entire healthcare ecosystem. Right, we can see one of the biggest pain points is that outdated claims data. The members only interact with providers around specific care needs instead of their entire care plan. Some providers are very much in the dark around what's happening as that patient moves across the healthcare ecosystem. And we touched on also, they only have line of sight into the clinical data in front, and they don't have any type of awareness to where they're flying blind. And where they're flying blind is usually where those gaps in care happen and the most harmful accidents happen for patients. I really loved this picture when we came out of our research here, because we can see how all of the data starts to come into the different workflow in lots of different areas. And then it highlights where we can start to integrate that clinical data, medical data, the social determinants of health to make better outcomes for the care managers who are interacting with patients, but better outcomes for their patients and all of the people that are caring for them. So that brings us to our second poll question here. What types of data do your care managers need?
Kat, this is a really robust question. I'm sure there could be 20 additional bullet points on the question. We're limited to the 5, but what types of data do your care managers need? Timely access to hospital admissions, ER data, EHR data. I mentioned that full medical list, including over-the-counter meds and cash pay meds, things outside, typically outside that healthcare data flow that you just showed a minute ago. And I'm going to have to digest that. I'll go back after the webinar and look at those two flow charts. They're very comprehensive. But you also are bringing up here that real-time component of healthcare, and it seems like very little in healthcare is real-time right now. I smiled as you were describing what you had observed in the research, and wondered where the fax machine sat in the middle of all of this, because it seems like every time I turn around, I'm seeing those devices being used and wondering what's happened to the 21st century that we're in. So let's see what those results are. This will be interesting. Oh. Kat, I'm going to let you and Justin do some interpretation on this. Let's see. Obviously, the full med list, kind of a tie between appointments and admission data, behavioral health. Any comments?
So I don't have access to see the results. It's not popping up on my screen because I'm the presenter here. But I think what it sounds like is that we've got a mix of results, right? It's kind of across the board or what the important areas are. And I think, you know, to that slide that Kat noted that she really loved is, you know, depending on in what area of kind of, you know, we use care management to talk about so many different components of what we're really talking about, which is, you know, that support between transition of care type care management or the disease management aspect of care management. And so it kind of depends on what component or what area that you're working within that. So I could see why, depending on the crowd that we have, you know, connected today, there might be a various, you know, level of information, or different levels of information is probably a better way to say that, that would be, you know, involved in how we ultimately can, you know, return or the data that is the most necessary for us.
Justin, just so as we move into, I know the next section, you're going to talk about how data empowers our outcomes. The results were by far letter B, that full med list was 83%. And then A and C were tied there, and then the rest were around 50. So it's that timely access to that full med list. And then some of those more consumer elements there with line C.
Thank you, Kat. I appreciate that. So that is obviously also not surprising to me. Those medication lists are so critical because obviously, you know, so much of you know, care management is adherence to the routine, and medications are a huge component of that. So that makes obvious sense as well. So let's talk about how we ultimately can use that data to empower care managers, you know, throughout this system. So when we kind of call back to those problems that we were talking about earlier in the presentation, let's, you know, we went through some of the current state components of it when we start talking about first that data feeds aspect of it. So the individual relationships that are being created, as I mentioned earlier, they're only covering certain components, certain areas, and don't necessarily give us the consistency that many of our programs that we want to be able to enable are allowing us to do this. You know, the way that Surescripts is approaching this overall and working with our partners in the industry is to say we need to be able to have that consistent, you know, integration point that ultimately gives you that most comprehensive set of data. So to the point Kat made earlier around having that 360-degree view of the patient, regardless of what care setting it is, regardless of out of state or in state, or regardless of if it's you know, at a small local provider versus a large integrated health delivery system. We want to be able to enable that because it ultimately it improves the healthcare system as a whole when we look at it. So what those opportunities are in that way is, you know, the ability to consolidate spending around creating these data feeds, and then ultimately provide a you know, the care manager folks the ability to spend the time working with patients and working with the members to ensure that they're getting the results that they need versus just being you know, a data capture component, which is unfortunately one of the things that we see throughout is them spending so much time just capturing data about the patient versus actually talking about, all right, what's the next steps? How do we make sure you're picking your meds up? How do we make sure that you're taking those medications? How do we make sure that you're showing up to your cardiology appointment with the next time that it comes in? So those are some of the areas and we see as opportunities, throughout the industry. So next, turning to the next component of it, and this is another one that Kat focused on, is that ability to integrate the clinical and the social background information to give us those tools. This is one of the areas where, again, kind of harkening back to what I just said on the last screen, where that data capture or the data capture aspects of this are significant. So our ability to be able to pull in all of that information through an effective, interoperability solution and collect all of the information that's necessary, so it can pre-fill those assessments, can pre-fill and help support setting the right goals, because then we can get the patient on a much more consistent and ongoing plan in those scenarios versus just spending the time saying, oh, what additional medications are you taking, and going through the whole rigmarole, as we all know about. Oh, it's a pink pill and it's about this big, and I think there's an S on it or something like that. And patients are terrible historians, and if we can go through and pre-fill most of that information through effective and efficient data, we're going to improve those workflows and allow us to focus on those clinical tasks, as I mentioned. So the other area that we're seeing are in those barriers and the gaps in where information is ultimately available. And I called out in the beginning of the presentation, our ability to be able to kind of set the framework, or the need to set the framework, so that when we're talking about exchanging data with care management areas, regardless of the care setting, whether that's within the payers or it's in a clinical setting, everybody needs access to all of that information if they're serving that role with the patient, because it's so critical. And so one of the things that we need to be able to do here is to be able to seamlessly share that information across all of those components, and really recognize that those necessary care management functions that payers and public health and other folks like that are ultimately taking on those roles to do, that we need to bring them into this overall system and ensure that they've got access to that. And that's going to pay huge dividends in terms of what we ultimately can see as a benefit to our healthcare ecosystem as a whole, not just to the individual patients, which is, I think, obvious to all of us, and getting them the support and the things that they need. So the timely aspect of it. So, calling back to our poll question, and we noted in those two, the A and the B response, both timely aspects of care were an important aspect of this, or an important part of our ability to be able to exchange data in this way. And at Surescripts, this is an area where we focused. Obviously, we want to ensure that everything we're doing is as much in real time to support the necessary components of care management and other services that we obviously offer. And so when we look at the current state with claims data and other aggregated information sources that typically have delays and other components, we recognize that the system just isn't working. I mean, my personal example where I got a call 2 months after it would have been really valuable, and I'm a little selfish in noting that again, but I really would have loved the help at the time. If we can break those barriers down and ultimately get the information to those folks at the time when it's needed and at the time that it's most critical to a patient, something that we refer to as kind of the moments that matter in a patient's life. If we can get that information to the right folks, then we're going to change the way that healthcare as a whole is operated in these scenarios, and allow us to really switch from that reactive mode that many folks are in this care management world to being proactive and ensuring that we've got folks on the right care channels, we've got folks in the right care management programs, or the right providers or the right treatment plans, before we see some of the catastrophic and terrible, injuries or, disease states that we know are just so costly and obviously devastating to patients. Again, hitting on the timely aspect of it, tying back to that encounter information for our ability to be able to see that across all care settings. So we recognize that it isn't just the ability to be able to go and get clinical information when it's needed. It's being able to understand every care visit, where it's happening, when it's happening, so that we can start to define some of those gaps. I think in a lot of ways, there's so much information out there that we haven't even realized that can be plugged into these programs, to define the right set of members, to be able to, focus in on, potential risk categories that we haven't even considered because we just don't have that information in a place where it's able to be utilized and followed up on. And so this again ties back to the lagging claims data and other information that's ultimately out there, or the aspects of it that are really regional or focused specifically on certain care providers versus really looking at it holistically. And so if we focused in on the opportunities to be able to proactively intervene, the second that person steps into an emergency room or is admitted into the inpatient setting, or we see a specialist visit that ultimately was unexpected, being able to follow up with that patient and establish that relationship as early as possible gets them on the right path before we have to follow up in 3 months when they're in the hospital again, or before they, or when they're in the emergency room for the third time. Those types of things are just critical for us to be able to, I think, get into these programs, and we haven't even conceptualized them in a lot of ways as to how we can even use that information to intervene appropriately. So then we get down into the actual aspects of, exchanging the clinical data. And here's where we see the fax machine showing up again. As noted, this is a critical component of our health interoperability system right now. Whether I like to admit it or not, it's a necessary tool. Because we don't have all of those, the roads or the rules to the road, even in certain cases, to be able to exchange data in this way. And what it leads to are the exact problems that Kat was mentioning, where you're receiving a fax and you're scanning in something, and if you're in a really nice place, that fax is already in a digital format and it's a file you're moving around, but very little of it is ever automated, right? And so the visibility into that information is just delayed for processing, for claims data, for whatever it might be. And so when we think about how we can get access to that clinical data, building off of what I was just talking about, if we know when and where those care events are occurring, at the time they're occurring, we have the ability to then also interact with those locations electronically and say, this patient is flagged for our care management program. We need to be able to access their clinical history and allow them to get into these programs so that we can ultimately, again, interact with that patient at that place where it's critical to them, where they have the most questions, where they have the most access, to follow up on their care at those points. And ultimately, get access to that full record at the end of the day to ensure that we're getting them into the right programs for them to be able to, support the needs that they have. So when we take a call back to that image that Kat talked about earlier, and we remove all of those barriers, what we ultimately see is still a very complex system, but a system where information is flowing across the network to be able to take in information in a consistent way up in that upper right hand corner. So feeding into those population health management programs and analytics programs to define the right members that should be in these programs first and foremost. And then as we go through this system, we're ultimately breaking down those barriers and identifying additional gaps so that when we're interacting with the providers and the members, that we're efficiently and effectively addressing those types of concerns. And then as we're pulling clinical data in a real-time format, those care managers are spending a lot less time reviewing and being that historian or that historical data capture mode and can actually proactively work on what are the next steps to getting you to wellness or to getting you to that next goal that have been outlined by your providers, versus just trying to understand even where the patient's at, which is so often happening. So when we combine a consistent focus of how we get access to data, and then in utilizing that data to define those effective barriers and gaps, and then ultimately support the real-time aspects of it, we can create a much more efficient system and ultimately get the types of services and information that is needed to everybody throughout that care chain to effectively manage the patient's care and ensure that we're getting the best results, both from a patient health as well as from a cost perspective. So I will turn it back over to Kat now to kind of talk about what that journey looks like.
And while you're doing that, Kat, let me just remind everyone, we're seeing some questions come in, but please use the Q&A function to put in your questions so that we can address those in just a few minutes. Sorry about that, Kat, but please continue.
Oh, not at all. This is my favorite part of the conversation here to end with, and then open up to those questions that everybody puts in. But right, we started the conversation talking about Surescripts' unique position in the marketplace, that we have the ability to see across many different market segments. A lot of our partners across the industry trying to solve the same challenges in a different way. And we know that those 17.5 billion transactions that cross our network are not just transactions, they're patients. Those 324 million patients having care events. And so when we wanted to bring our interoperability portfolio into the care management space, we had this full intention of making sure that we elevate that care management space so that the patients and all of the people that care for them, we improve those outcomes during the moments that matter. And we took all of that intention and all of the research that we did from that user experience, spending a lot of time with our care management functions to package together our solutions for this new journey. So our ideal world here, when we have everybody participating across the Surescripts Network Alliance, is for this seamless journey that Joyce is going to have. Okay, great. As soon as I could get the slide to go. So Joyce is a hypothetical patient, but a very common scenario. So Joyce here, she has very well controlled diabetes. She has type 2, she's a type 2 diabetic patient and has recently moved from California to Minneapolis. And when she moved to Minneapolis, she did all of the wonderful things that we hope all of our patients do. She went and found a primary care provider. And that primary care provider was able to subscribe to Joyce to make sure that she kept in touch with Joyce as she moved across the healthcare ecosystem to all of her different specialty clinics. She made sure that Joyce was still in contact with her care management function. She's a part of an ACO, so that the care management function was also subscribed to Joyce. And so that they would get a notification should she have any type of adverse event, or make sure that she also was staying in contact with everybody supporting her to make sure that those diabetes stayed well controlled. So once Joyce moved to Minneapolis and was enjoying the Twin Cities here, I'm saying that she moved in our beautiful summers and not our frigid winters. She had an unfortunate and unexpected medical event. She had a congestive heart failure and was placed into the hospital. But because Joyce had been fully engaged with her new primary care provider and they were subscribed to Joyce, they received a notification that Joyce had been admitted into the hospital. The ACO that is working with Joyce also received a notification that she had been admitted. So the care manager was also fully aware that she had had an event that she needed to make sure that she followed up with once Joyce was discharged. Fortunately, she got awesome care in that health system. They were able to run a med rec so they could see that full list of medications. They were able to pull in all of Joyce's clinical history with record locator and exchange in the health system, so that her care plan, as she moved across the state and into an acute setting, went with her, and she got the best of care possible. When Joyce was discharged, the primary care provider got a notification to make sure that Joyce was setting up that follow-up care with her. So did the care manager. So the care manager also got a notification so that she could follow up with Joyce on those discharge events and also add her into the congestive heart failure tracking group for so now that they could watch Joyce with her two different specialists that they need to make sure that she's getting the right level of care. So while it wasn't an unexpected medical event, when we had that 360-degree view of Joyce as she moved across the healthcare ecosystem, we made sure that all of the people caring for her had moved from that reactive place into a proactive place, sorry, on the slide there, because they had been notified that she had moved into the health system. All of her clinical history went with her. She had been discharged from the health system, and all of her clinical history is still going with her, and those notifications of where she's at and if she's receiving the care that she needs. We believe strongly in the care management space. Here we go. And believe that it is a vital segment to making sure that we improve outcomes for all of our patients and all of the healthcare ecosystem. When we have the ability to provide that, to move out of reactive into proactive with care event notifications, when we have the ability to give real-time access to a patient's entire clinical history, and then we open up the lines of communication between all of the care team with clinical direct messaging, we know we can provide a better member experience. We believe that that care manager is really important as they walk with that patient into that journey of wellness. And when they have all of that right information at the right time in the right place, that 360-degree view of the patient, it transforms outcomes for everyone. Justin, is there anything that you wanted to add on before we move over to questions?
No, I think you hit it. I think I'm happy to answer any questions that folks have.
And I see questions coming in, but as I do that, Kat, as you described Joyce's experience, and it wasn't that many years ago, I was relocated after 30 years in Boston by my employer to Salt Lake City and had to get a new primary care physician. And I remember sitting down with Dr. Jack and he said, well, I need your medical records. And I had gone to the same doctor for 20 years. And I said, what do you need? He said, well, just everything. And it was 1.5 inches of paper that I paid 25 cents a page to have copied, and it's set in my folder. I know he couldn't digest it, he couldn't use it. Luckily, I've been in healthcare, so I knew what was important along the way. But what a dramatic change, and that kind of relates to a question that came in here some time ago when you had the data flow chart up, and I decided not to interject it then, but it really is the question of how or what can be done to accelerate the adoption of, on that page, what looks like a very integrated approach to care management and to data sharing. Any thoughts or insights from either or both of you on how you accelerate the adoption?
Justin, do you want to start?
Yeah, I was going to give you the chance to go if you wanted, because you know I have a lot of things to say. I'll try to keep it brief. I think the biggest thing is coming to the realization that this is what patients want. I think the world that we're living in, and I obviously have a background in electronic health record vendors, so that's the lens that I come at this with, is so much of your concern, as an electronic health record vendor, and you can apply that to really any health tech organization kind of throughout, throughout the healthcare ecosystem. is that we need to ensure the safety and security of our information. And often what that leads to is this idea that sharing information in any way, shape, or form is ultimately too risky for us to do that. And that ultimately leads to, I think, a lot of the challenges that we talked about today. So, you know, things like what we've been doing within the care quality community, things like what we've been doing in our partnerships at Surescripts with our, you know, the PBMs and the pharmacies and the other folks that we work with to say, let's start thinking about this outside of it. We've created the systems that allow us to exchange information, you know, from providers to providers seamlessly, real time, and we're doing that often and today, and we've got to fold those other members into that function. So the technology is there, and so really it's a lot of perceptions and you know, kind of legal framework aspects that are necessary for us to take those next steps. And to me, I think it is really we need some of those first movers to kind of look at it outside of it, outside of the like, okay, point to point, we can deal with this, but think of it more on that network scale and say this is something that needs to happen across the country. And once we have a few of those first movers, really start to integrate this data in this way, I think the dominoes will fall and we're going to get the realization of exactly what we were talking about today. So hopefully I didn't go on too much of a soapbox there, but those are my thoughts on that, on how we accelerate it.
The one thing that's great, Justin, you always have a lot to say there, so I let you go first. The one thing that I'll add there, Ferris, it's a great question. It's a fair question. I think a lot of us have been at the interoperability and accelerating the flow of data for a really long time. And so one of the things I'm most excited about is as a team, we've been really focused on maximizing the technology that's in place so that we don't have to rebuild from zero. And the way that we're doing that right now is that we are leveraging our eligibility transaction, right? Of those 324 million patients, we know what care event they're having across the entire healthcare ecosystem 80% of the time. So we know from an eligibility transaction where they're showing up or where they're getting ready to show up. And then we're leveraging our med history transaction. So we know if somebody's running a med reconciliation, that they're in either an acute setting or a specialty setting. And we can tell that there too. So we're also pairing with that our ADT transactions and our clinical direct messaging transactions so that not one solution or not one customer on our network is solving this for us. We're saying, hey, we can go a lot further, faster together. Let's put all of it together. Let's see where all of those patients are at. Let's connect all of those pipelines together and really accelerate the movement forward.
And I appreciate that. I'm going to go back and do a word search when we finish the recording on this. I want to see how many times we've used the word timely. It seems like timely in healthcare doesn't exist with all the legacy systems, but I appreciate both your optimism. The technology has changed dramatically and rapidly. The cost of data storage and the sophistication of analytics has gone down. I see a compliment here, one of the best demos in a long time. Love the setting up of the story. Thanks a lot. Great point about removing data silos between clinical medical data and social determinants of health, as we see payers and providers need to join hands for real patient member care. Any roadmap, it does end with a question, any roadmap for home health integrations? Ouch.
Yeah, I'm happy. Oh, go ahead, Kat, if you want to jump
Justin,
in.
I might be the only one you cut out for just a second. I'll wait until your face, I'll talk until your face unfreezes and we'll see if you're still having network issues. We are in home health right now. All of our portfolio, so the three that we, Justin and I work on is clinical direct messaging, record locator and exchange, and care event notifications. Those are in home health right now. And we're really happy to talk to you about how we can integrate and accelerate those further into improving solutions for you. But for home health, we know that they got left behind in some of the different regulations, and so it's been a slower adoption and utilization there, but the offerings are still there, and we're really, that's a really important space for everybody in healthcare, because those are our sickest, most high-risk patients. And so as we really make that transition to value-based care and improving outcomes, everybody's very interested in making sure that they are getting that seamless care regardless of who is providing it. So we are there. It's on our roadmap. We're continuing to make those solutions better, specifically for our post-acute care segment, including home health. And so if you have more questions, please don't hesitate to reach out to me. It's something that I love to talk about, that scenario that I shared with the 5 different systems was in a home health and a long-term care setting.
Excellent. Excellent. Any additions, Justin? I can see we're coming up towards the top of the hour, and I just wanted we as presenters don't see the name of the questions coming in, but I got a prompt here from my sidekick that Rana submitted that question, and we really appreciate the questions that are coming in. We have a number here. We will definitely follow up in the follow-up and sharing the recording. We will answer some of these additional questions. But Justin, any final comments from you?
Yeah, I just make one addition onto the home health stuff, and you guys are hearing me again now, right?
Yes.
Okay,
yeah.
Perfect. So the one addition I would make is that, I mean, this is not surprising, home health is changing quite a bit because of the pandemic. We see a lot of new entrants into how can we help support care at home, and I guess I'm expanding probably maybe the traditional definition into more of the concierge type practices and all of those types of things. And because of that, we're seeing a lot of new technology coming into that space. And you know, whether it's monitoring devices, video devices, you know, the tools that are able to be used in that home care setting. And with that, you see a lot of organizations that we're talking to and working with who are coming to the idea of, I'm not just going to create this thing that I can use for home health. I am going to create this thing that is considering all of the different places that data needs to go. So I think that's an exciting aspect of it. And you know, it's not necessarily on our roadmap in terms of like specifically how we're tackling it, but making sure that we're bringing those new and innovative technologies into the fold as they're coming online is a big aspect of how we continue to fold in home health into the broader data exchange world.
Terrific. And you can see a link to get further documentation, further information from HCG and from Surescripts. And again, keep the questions coming. I'm more than happy to share my email address, which is ft, very hard, ferristaylor@hcg.org. And I'll get those to Kat and Justin and the other thought leaders that we have here. We do have, and we've held about a dozen of these roundtables this year, small group discussions. We have one on interoperability coming up here in a month. You can go to our website or click the bit.ly link that's here to join those. In closing, I haven't said much about the Healthcare Executive Group. We're a national network of executives and thought leaders. We've actually been in business 30 some odd years, working together to improve and reshape healthcare. Our mission is very simple: guiding healthcare executives through innovation, change, and growth. And this discussion with Kat and Justin has definitely touched on all of that. I think there's a final slide. We interact regularly across a large number of channels, including these webinar series. We do national industry pulse research, have reports that we publish, newsletters, and other activities. And by facilitating the frequent interaction and sharing information on thought leadership, we actually create a network for executives working together to solve healthcare problems. So you can always learn more about how we convene and network and facilitate interactions by going to hcg.org. So with that, let me thank especially the two of you, Justin and Kat, for a great presentation. I think all of us will want the slides so that we can dig into those flow charts just a little bit better. And I saw that you did highlight some real points of pain that are important. But in addition, we want to thank each of you as attendees that have been on today, and those of you that will listen to the follow-up recording when we share it. We appreciate your time and attention and the questions that have come in, and we'll follow up on all of those as well. So thank you and have a great day.
Thank you.